Good morning. We are Let It Heal Live, coming to you from Toronto this morning, and we're going to be talking about MS.
Absolutely.
I've been looking forward to this show.
I have too.
Because I seem
right
to speak to so many people that have MS or that have a loved one that has MS.
They're dealing with it in some way, yes.
Yeah.
It's out there. There's a lot of it
It's
right now.
huge. It's huge. And from what I could gather, and we can probably confirm this with one of our guests, but 75,000 Canadians apparently
Are suffering
affected
from it,
with
yeah.
it. Yeah, and it varies. I mean, some people are pretty severe and they're in a wheelchair, and some people are still working.
Yeah, still mobile, still, first stages.
Yeah, so it's, but it does affect everyone, and I don't know, we'll talk about what all the symptoms are and the varying degrees of it, but I'd like to talk about what people can do to feel better.
Absolutely. Well, that's
Most
what it's all
importantly.
about. Yeah, what
Exactly.
can we do to alleviate some of these symptoms associated?
Yeah, and how to pick up on it too. Like, I know I've spoken to some people that said, "Oh, I wish I'd known. As soon as my vision started to go, I should have known."
But people don't know what some of the early symptoms
Yes.
are, and that's important.
It is. And we'll get that message out there. Now, we've got a bunch of guests coming. We've got some people in studio today. We're going to be speaking to Michelle Kingson from the MS Society. And she's from the Toronto MS branch. Halton? Oh, okay, great. I was thinking
excellent.
it was going to be Robin from Halton. She's got a cold. Everyone's got a cold right now.
It's the season.
Yeah, it's that little tune-up for the immune system, I
Yep.
think. And so Michelle's going to be speaking to us from the MS Society. I'm really glad that she was able to join us.
I am too.
And we're also going to have Kathleen Lynch, who is Skyping in. She's, I believe, in Seattle. So she's going to Skype. We'll just do a quick Skype with Kathleen. She has MS or had MS. She's tried a new type of treatment that she's a big advocate for.
And it looks
CCSVI.
promising, but it's still new.
Yeah, it's new. She didn't do it in Canada. She's hooked up with a doctor in Egypt.
Oh, okay.
Yeah, they're doing this in
Nice reason to
various
go to
parts of
Egypt.
the world. Yeah, really. Nice excuse. Although I'm pretty glad that I don't need to.
Oh, this is true. This is true.
And so we'll talk to Kathleen about that. It's Dr. Zamboni. It's this Italian professor,
Okay.
doctor. He discovered it. So Kathleen can tell us about that. Also going to be Skyping in is Anna. I'm not sure how to say her name. Anna Delorme, I think, or Anna Delorme. There's an
we'll
E
find
on
out.
the end. Yeah. She's also been through the procedure. So she'll be just touching base later on. We're going to be speaking to Sharon Danley. She's got her health and beauty tips. I think Russ, Fit with Fuss,
Yeah, we'll
is going
see
to
what
be
he has to say. Yeah,
calling
or-
in. He's got family members. He knows tons of people. Like for the last 10 years, he's been dealing with MS, and he knows how it affects your life. So he was really excited about getting involved. I just don't know if he got my message that yes, please call us.
Yeah, I guess we'll see.
So yeah, we'll see what happens at 10 to 12. We might have to do a tap dance or something
You could do
entertaining
the
for the
tap
last
dance.
10 minutes. And so that's gonna bring us. We're gonna have a pretty full show. We've got
yeah.
Dr. Esther Konigsberg here. Thank you for joining us.
Pleasure.
Now I'm going to introduce you. You've been on the show once before. You came on our integrative medicine show,
Yes.
which was appropriate because that's actually the name of the company that you have, Integrative Medicine Consultants. I think I've sent you Dr. Konigsberg's
Yes.
history. You're a medical doctor, but you approach health with an integrative sort of attitude, right?
Right.
So what does that mean, if you don't mind explaining?
Not at all. So that means blending conventional medicine with prevention and complementary and alternative medicine. So it's a very broad-based approach. It's very relationship-centered, partnering with the patient and looking at all avenues for health and healing.
Right. So if that needs to be medical, then it's medical, and if it needs to be elsewhere, you just pick and choose, right?
Exactly.
Excellent.
That is excellent.
Makes sense.
And that's
could
what
just
we need
call
more
it
of.
sensible medicine. As far as I'm concerned, anyway. So for more information, obviously, the website is Integrative Medicine Inc. cusp.com.
That's right.
People can just go there and get all your contact information. You're in Toronto and Burlington.
Yes.
Right? So that's nice. I'm
that
so
is nice.
happy that you're in Burlington. I tell my clients about you all the time. And you're not necessarily an expert in MS, right?
I'm not an expert in MS. I mean, my background is family medicine, so I've definitely had patients over the years who've had MS, but I work with neurologists. Once somebody's been diagnosed, it's best for them to have a neurologist that they consult with and who works as a team member.
Right.
And so I'm the non-expert, but basically supportive, as well as I bring in the integrative medicine approach, more
Right.
natural sort of approaches that people could do to optimize their health and wellness, and also to mitigate some of the symptoms and maybe even have an effect on progression.
Excellent.
Yeah.
Absolutely. So they've got the neurologist on their side and who's keeping you in the loop and all that sort of thing, and you're giving them the extra
And doing
support.
the appropriate treatments as well. And what I do is I support them, again, through an expanded approach.
Excellent.
Speaking of cold, sorry about that. I've had one myself.
I know, everyone's got
sick.
it. Yeah, you were really sick last week, right?
I was sicker last week,
yeah.
yeah.
I'm glad you're feeling better.
Thank you.
So what would be some of the things, if someone's seeing a neurologist, they're probably going to, if they've just found out they got MS, they've probably got some emotional issues. So you'd provide some sort of support there, I guess, or referral.
Absolutely. Basically speaking, what you mentioned before about how many Canadians are affected, one of the things that we've started to realize is that the further away you live from the equator, the more likely you are to have MS.
Okay.
Wow, that's
I did not know
fascinating.
that. Okay.
I'm
Yeah.
moving tomorrow. That's an excuse to move.
Well,
Absolutely.
and so there's some reasons postulated about that. One is that we have less sunlight exposure, less exposure to vitamin D,
Yeah.
and so and we have as Canadians often lower levels of vitamin D circulating around, obviously, especially in the winter months. So
Right.
vitamin D is one of the things that have been postulated. The other one is our North American diet that's very high in saturated fats, that are very high in trans fats. So there's a lot of theories around, there's genetic theories around MS. There's inflammatory infectious disease theories around MS. We're really not 100% sure how all of that factors in, but the whole idea about doing a very supportive approach is to look at all of that,
Right.
and to make sure that everybody's, if you will, ducks are in the row in terms of
Yep.
getting adequate vitamin D, supplementing with vitamin D, doing a proper diet, which we call, let's say, an anti-inflammatory diet, which means decreasing animal fats in the diet, that's the saturated fats, decreasing processed foods, which is where you get a lot of your trans fats from.
Right.
This is basically a healthy diet, of course, increasing the healthy fats, which are the omega-3 fatty acids. So that comes from cold water fish. It comes from some
Hemp hearts.
exactly
They're my
that.
new favorite thing.
It's funny because our poor clients that are our viewers, they hear this every week. We're like, okay, so we're talking about this. Okay, so you need to change your diet.
Yeah, well,
And that's just the way that it is. People need to start looking at their diet
well, it's
here
one
in
of
North
the things
America.
that you do have control over, and it's something you can do on your own, right? And
Absolutely.
people can research the types of foods that, okay, well, I don't like fish, so how else can I, like you said, you can get some nuts, or, people can go to the library and get a book on nutrition.
Absolutely, but here's a caveat about plant-sourced omega-3 fatty acids, is that we as humans don't do a great job of converting them to certain compounds called EPA, and especially for the nervous system, DHA.
Right.
So for people who don't really love fish, but who aren't morally opposed to eating fish, your other way of doing it is through supplements.
Right.
Yeah.
So you can take omega-3 fatty acids through supplements, and especially the DHA component is especially important for people with MS. So you
Yeah.
can really increase that through supplements if
And
necessary.
you don't have to take the oil off a spoon. They have them in capsules.
They have
too
them
now,
in
right?
capsules.
So-
Some people say it repeats on them. You can put them in the freezer
Yep.
if it does repeat on you.
Oh, that's a
And
tip. That's a good
and
idea.
that tends to pass through things lower down in the gut, so that when it does get absorbed, it won't
Yeah.
create
Nice.
that problem. B vitamins are also really important in MS. And then there's also certain antioxidants that are specific for the nervous system. alpha lipoic acid, N-acetylcysteine. It increases glutathione.
Right.
And glutathione is really important for a functioning nervous system, so that's also helpful for MS. So there's a lot of things one can do. And then, of course, as you were saying, Amber, emotional support is key. You know, people who have MS tend to suffer a lot more from depression, and they really need the support from a really good healthcare professional. And it could be their family doctor, it could be an integrative medicine consultant like myself, a therapist who's used to dealing with patients with MS. I'm sure the MS Society knows of a lot of supports as well in the community that, you know, really helps people to get through it, and often even just linking up with other people who are having it, you know, being part of a support group and looking at the positive.
Then you don't feel isolated.
And
exactly.
I mean, I'm assuming that it just must feel so unfair.
Oh, absolutely. Why me?
Exactly. Why is this happening to me?
Especially if it's someone that maybe has had a healthy diet and always done, well, I've always followed the diet. How come I'm sick, right?
So you want to try to reframe things for people to make them feel like they've got a locus of control, that they have the proper support, that there is optimism and there is hope, rather than, you know, feeling that it's all doom and gloom.
Yeah.
Right? So it's just
nice.
getting all of that. Physical activity is really important. Though it's interesting, if you do have MS, exercising to fatigue is not recommended, but things like aquatic fitness or yoga or Pilates have been shown to really be very important in terms of moving forward.
That's good to know. That's helpful, and
It's
those
very
are, I mean,
helpful.
they're pretty trendy too right now, all those different things. So yeah, life's not over.
So working with a healthcare practitioner who really knows about these other things that can support conventional treatment, and, you know, and understands how it interfaces with conventional treatments.
Right.
You know, a
Wonderful.
really good idea to support people who have MS.
Well, thank you.
My pleasure.
You just sent a big ray of hope out there to a lot of people.
And body work.
Absolutely.
Right. So there's different energy therapies like Reiki, and I know you do Bowen therapy.
We've seen Bowen do so much good.
Incredible.
In some cases. I've worked on some
Exactly.
people with MS that, I mean, one lady that hadn't moved her legs for 7 years, and after a couple treatments, it was wonderful. I remember her calling me saying, I'm standing in my kitchen.
Fabulous.
And we all cried.
We did. Yeah, it was a big moment.
Yeah, it was a pretty big moment. And then for some people, it's just a matter of maybe they're not in a wheelchair. They don't need their cane anymore because they're not feeling, because sometimes it's just that sense of balance, right? So any sort of body work can help. Obviously, I'm a big advocate of Bowen, but...
Yeah, and many of us think of MS as mainly muscle weakness, but a lot of people do suffer from pain. So doing a lot of these body therapies can often really help to reduce pain without having to